And we're just connecting and we're now recording. So you can start, Bronwen. Thank you.
Okay, thank you everyone for coming along to hear about embouchure. I'm trying to control myself and not tell you absolutely everything because it's a fascinating field. I've been working with it for a very long time. So I'm trying to give you a taste of, if you like, the foundations of managing embouchure and understanding it, some of the movements we can do, and some of the ways to best treat it. How you, as you work with this and provide a good foundation, we can certainly add complexity, and I'll talk to you as we go along about some ways of doing this. So firstly, what do we mean by embouchure is the first thing we should talk about. So what we're talking about is what's happening with the mouth's relationship with the instrument, if you like. So when we play a woodwind or brass instrument, we're going to blow air out in a controlled stream through various ways that we control our respiratory system, from the pressure from our lower abdominal to the shaping of the upper abdominal apparatus, including our larynx or vocal folds. This production of air will go out through the aperture in your mouth, and this will create a vibration. So if you have a woodwind instrument like a clarinet or oboes, things like this, you'll have an actual reed that provides the vibration. If you're playing a brass instrument, you have to hold your mouth muscles in a way where your lips become the reed themselves. So the lips vibrate themselves to create this sound in the instrument. With flute, you're blowing air across the top of a mouthpiece that's going to also create this vibration. So we have this effect where we're blowing the air into the mouthpiece. This example here is with a brass mouthpiece, and this vibrating of the lips crucial for the sound production that you get on brass instruments. Just like allowing the right amount of vibration of the bamboo reed is also crucial on woodwind instruments. So I've just put some quotes with the brass community. So for the brass community, because it's lip reeds, so because they have to get their lip tension and movement exactly right, or they can't make a noise, they don't have another reed they can put in their mouth, it's actually essential that embouchure is functional to make their sound. Ironically, there is no agreement in the brass world on how this works, and even in woodwind, there's not a lot of discussion about it. So some of this has come about because, in fact, even as an anatomist, we don't know such a lot about how all these incredibly complicated group of muscles work together in something like the elite sport of being a professional woodwind or brass instrument. But we know a lot more about it now than we used to, and some of us that especially work in this area understand quite well how this functions during performance. The traditional music teachers, it's very varied what information they know. Often they've only been able to access information from their teacher themselves. So in the community of brass in particular, talking about the muscles you use when you form an embouchure is very much fueled with fear. They have this saying, paralysis by analysis, like you shouldn't think about how your embouchure works, or else suddenly it won't work at all. It's a bit like the centipede walking little story that goes on, that if he thinks about which foot he has to put first, he can't walk. However, you'll see much more wise discussion about this now, saying, well, what is the analysis that is coming into this brass performance? So often the way embouchure has been analysed hasn't been based on foundations of anatomy or on the research that we've been doing to better understand how embouchure works. So if you're basing it more or less on what you think you're feeling or what someone might have told you once in a conversation, it may not be the analysis that's right for that person. And as someone who's worked with this area for a long time now, I think it's quite complicated to analyse, but you have to be very systematic. I would also say embouchure is a team player. If we go to a slight sports analogy here, we're not just looking at one muscle doing something. We're looking at a whole lot of muscles that have to work together with other systems like our breathing or our tongue movements, things like this. They have to work together to be able to produce the sound, and this is a part of the team. So the functioning of these facial muscles is incredibly important, and we need to look at it in combination with the other structures. So I went looking to see what sort of fantastic analysis was given in terms of details on how to form an embouchure. So we have things like tense the lips and face, except at the center hole where the air is coming out. This is not really a terribly helpful way to work out how to form an embouchure. And then they have these other things like these little lovely mathematical equations. Well, you just put it together and it makes a sound. So a lot of your students will have no idea what muscles, the professional players, music students won't have any idea what muscles they need to use and how best to use them. There are a couple of very pivotal texts from many decades ago that where players did try to sit down and look at these, and they're still in common use today because they had some good attempts at trying to make some understanding. Now, with the advent of things like EMG and lots of other tools like this, of course, we understand a lot more detail, and I'll go into that now. Why do we care? Because orofacial problems are a massive problem in woodwind and brass community. I'm working particularly with embouchure dystonia at the moment, and this is usually career-ending. However, with these kind of ways of reworking the coordination and strength of the system, I'm getting people back to playing quite successfully. It is a process and it's re-coordinating a whole lot of things working together, but it can work very well. Just to say the other thing we deal with, because I'm going to briefly talk about this first, is a lot of jaw problems in musicians, particularly in the wind and brass, but also obviously other players like violinists who rest their chin on the instrument. But the statistics show that the number of injuries is huge, and these are people who are replying and admitting them. So we have a very high amount. In the German musicians, this was a very large study. Germany has a very high population of musicians, and more than half of them have facial or jaw problems, but more worryingly, 10% of these can't work due to these problems. So let's talk about first, I will talk a little bit about the jaw problem first for a simple reason, that the jaw is the scaffolding for your facial muscles. As many of you will know, your facial muscles are sitting on the surface of the bones on your face. And if the jaw is doing the wrong thing, the jaw muscles are very strong. They're designed to chew through apples or steak or whatever other firm objects. You cannot use a little facial muscle that's doing these kind of movements to fight a jaw muscle. So the jaw must be in a position that facilitates function of the orofacial muscles, not that fights with it, because that will straight away be a problem. So overactivity is a big problem we have to look at. I think I have never seen an underactive jaw. It's always overactive pretty much. Often asymmetrically overactive. And you will find if someone's had a lot of stress, just look for perhaps they've developed a teeth grinding at night problem. These kind of embouchure problems that develop seemingly out of nowhere. Just look for things like teeth grinding if there hasn't been some other overuse playing or change in embouchure technique or something like that that's triggered the problem. Just see if they've been under stress or ask their dentist to check whether there's teeth grinding. We can check first, look at range of motion of the jaw. And I also always have a look at how well they can release the jaw, because when you're playing an instrument, you're actually working in just this first, so when we open our mouth, the first half is just actually letting go of jaw muscles here. The second half, when you open your mouth really wide, uses other muscular contraction to do it, this part. But in the first half, which is where we're working with musical instruments, it's a controlled release. It's using a bit less of the muscles that close your jaw so that it can open. And when you close your jaw, obviously you use these jaw muscles again. Very low levels of jaw activity. They think around 5% of jaw activity involved in playing a musical instrument. If 100% is chewing, the hardest thing you can imagine chewing. And just another thought anatomically, don't forget that our skull is sitting on top of our cervical spine. The upper lip is on parts of the skull bone up here that's not involved in this mobile mandible and jaw. The muscles, when they've looked at the muscles in the lip, in the upper lip, they're more stable, more aerobic muscles compared to the lower lip. So in general, this is our more stable part for our embouchure, and now our jaw is going to be the more mobile part with the lower lip. So we have to think of the teeth and jaw as the foundation. So in this case, we've got a brass mouthpiece pushing against. If we have an offset position, we have this airstream going in a kind of non-ideal manner into the instrument from the mouth and often hitting the bottom of the rim. If we have our teeth in a better position, we're going to have a much more direct blowing of air into the bore of the instrument. So we want to try and avoid these inefficient kind of positions that are produced by poor jaw positioning. As I said, I'm not going to talk about the jaw a lot other than to point out how many big, strong muscles close the jaw, and these muscles need to be loosened somewhat for people to be able to play. I always check, see if there's problems with the disc or problems with the muscles that might be getting in the way. Instruments that, like your instruments with the wooden reeds, so clarinet, saxophone, the oboe, bassoon, these kind of instruments that sit on your lower jaw, this is quite a hard thing for the jaw. So it's got to maintain a light resistance against the instrument. They're very prone to getting disc problems. This is a disc in your jaw, so you have a disc sitting in your jaw that cushions the jaw joint. This constant kind of weight of the instrument creates this kind of constant holding pressure on a muscle here, this lateral pterygoid muscle that holds on to the disc. And so they can get clicky jaws very commonly. This is very common and more common probably, as I said, in all these woodwind instrumentalists than in the brass players. And these are the kind of movements we have with the jaw that we want to look at. So we want to look at side to side, forward, back, and opening and closing. When muscles work on the jaw to move it, they work together. So we get some idea when we look at the way people open and close their mouth of what muscles might be tight or what muscles might be loose. The big thing to remember, as I said before, when we look at the jaw here, the first part of opening in this jaw socket is just the muscles here relaxing. The second part of opening needs muscles to work. So to get that second part, we have to have muscles to work. So if we're looking at someone opening their jaw, which we're going to do now, if we look, I'm just going to mute that. So when we look at someone opening their jaw, what we're wanting to see is how straight it is. And you'll see in this person, my daughter actually, as she opens it, there's a bit of a glitch in the middle. So as she opens, it's not completely smooth. There's a bit of a wobble in the middle. They call that an S opening pattern. So what it's indicative of is a TMJ problem. So her right TMJ is clicky, so she has a disc issue in her right jaw. And this happened after surgery, actually on her left side, where I assume they've pushed her jaw to the side and given her an issue there. Just a quick test. I tested a whole lot of musicians looking at mouth opening, and we measured mouth opening using calipers, and it ranges anywhere from 25 millimeters to 50 millimeters. It depends on how big your mouth is, you can imagine. One test that's often used and actually was very true to form when we did this testing with musicians is for normal mouth opening, you should be able to get your just more than your 3 fingertips in your mouth, your distal interphalangeal joint. So you'll see here, she can put her 3 fingertips in her mouth easily. So she's able to, it should be easy to get that in your mouth. If you can fit the whole lot in there, then it's a bit hypermobile, but you should be able to fit 3 fingertips in easily. We also want to look at side-to-side movement. So I'm just going to turn the noise off again there. So what we want to do is look at mandible movement, left and right. And this is checking how tight the muscles are on each side. So you should get 2, like down the bottom here, these teeth are called your incisors. You should get at least 2 incisors in each direction. So start, line up your upper and lower incisors, and then you should see the same amount of 2 teeth movement left and right. Okay, so this will give us an idea if we have tension in our pterygoids or again a disc problem in the jaw. These things are worth picking up early on. The other thing to discuss too is that a lot of musicians before they play, they might have been stressed or talking or just eaten or something like that. They often don't warm up and stretch out the jaw before playing. As I said, everyone that I see tends to be overactive in their jaw, never underactive. So I always encourage them to try and loosen up their jaw before they play, just some simple, big, wide open mouth kind of movements, like in that right-hand picture, side to side. You can combine them together a little bit. I have this very nice analogy, like a cow, where you do this circular movement, so one way, back the other way. They can even physically warm up their jaw by, as you open the jaw, running your hands down the front of the big masseter muscle here, the chewing muscle. You can find this by finding the point of your cheekbone. It goes from the point of your cheekbone down to close to the angle of your jaw. You have a parotid gland sitting on top of it, so you don't want to rub right on the parotid gland. It's not going to feel very nice. We want to rub along the front of it. And we have a couple of strong trigger points at the top and the bottom. So usually you want to relax your jaw open and then run down that front line, okay? Right down the front line. And your fingers are pushing towards the back of your head. You're pushing that direction. You can hold the pressure a little bit at the top. You'll find if you go right in under your cheekbone, push your fingers back, you'll often find a tender point in the masseter there that's a trigger point. And similarly at the bottom, you can find a tender point when you stick your fingers in there. So we run our fingers down there a few times before they play. As I said, it's always too tight, never too loose. So I get them to try and make sure they warm that up and get the jaw nice and in a nice resting state. Just in discussion about the kind of position of the jaw, this old x-rays, there was some fascinating old footage taken perhaps when it was allowed that we could x-ray people in the head without realizing what we potentially were doing to them. But you can see with the brass instrument, the teeth are quite close together. When we have clarinet or saxophone, we obviously have this wider mouth. As I said, a little bit harder on the jaw here. We get a bit more pressure on these lateral pterygoid muscles. The flute sits against the lower lip, so against sits on the outside against the chin, and that pressure is recommended, if you like, as a stabilizing part for the flute. So there's a bit of a forward push of the jaw, if you like, that's sort of part of supporting the flute, so they can also get tight in the jaw. And this is woodwind and bassoon. Again, the jaw has to be a little bit open, but we don't have quite the same amount of pressure against the lower jaw as you do with flute, saxophone, clarinet. So if we go on to the facial muscles themselves now, this picture, there's a wonderful old book that I managed to get a copy of where this dentist wrote a discussion on embouchure many years ago. And it's still got some quite nice pictures and sensible discussion on old literature. We know a little bit more about some of the interactions of these muscles first. But just to orient you, we have one main oral constrictor, our round orbicularis oris muscle. And pulling against it, we have all these muscles that will relatively dilate this. So all these muscles are going to pull out against the orbicularis. And this, in a way, is a bit of the key of playing these instruments, is getting this balance between closed enough to surround the mouthpiece of the instrument, or if you're a brass player, to provide the right aperture size in the middle to get the air vibrating the lips and working outwards. And all these muscles, some of them have more of a role than others. So one thing I want to draw your attention to that we're going to talk about in a second is this M written here on the corner of the mouth. It's not M for mouth. It actually is modiolus, as you can see here. This in Latin means hub. So modiolus, this part of your mouth is considered a hub because so many muscles go into this part. What you will hear in particularly in brass, but in other woodwind sometimes as well, is people talking about the corners of their mouth as engage your corners. I often say to them, this is actually, you have to be a bit more specific, because am I engaging my corner like this way, that way, this way? There's many ways I can engage a corner of my mouth because it's pulling in all directions. And this is part of where we need to educate the musos, and we'll go through some of this in a minute. So if we talk about this corner here, so we have orbicularis oris coming around into it, our constrictor. We have our buccinator. This number 7, this muscle is actually inside. This is your jawbone he's drawn here. It's inside your jaw. It goes, it's your inner cheek muscle. If you sometimes when you're chewing your food, chew your inner cheek, that's your buccinator. It's inside the mouth and goes to the back of your throat. I'll show you another picture of it in a minute. And we have levata anguli oris is pulling up through here. Zygomaticus major over here. And then we have this depressor anguli oris. So we have all these different muscles pulling in completely different directions. So orbicularis is going in, one's going up, one's going out, one's going down, every direction. These are very important in controlling the movement here, and we can see these muscle convergences very clearly. So when people are told to engage their corners, this is not clear. I always say, what are you hoping to do with engaging your corners? What they usually want to engage as a core element actually is this buccinator muscle, like this one that goes towards the back of the mouth. Because once they've worked out how wide they want their mouth to be, how much they want the lips raised or dropped, that buccinator then holds the position quite well and coordinates with the way the air is coming out so that they can get a good vibration or seal around the instrument. If we look at orbicularis first, I think one of the really interesting things about orbicularis is actually, even though it's always drawn here like one continuous muscle, it functions as 4 quadrants. So we have, if you like, a bit of fascial divisions in these 4 stages. So when we contract it together, you'll see this kind of movement, like a closing lip. So if you had a straw or a toothpick, close your lips around it, that's orbicularis. When we look at this, when I look at this clinically, and I've got a video I'll show you in a minute, I check all 4 quadrants. Often one is substantially weaker than the other in musicians with orofacial problems. Generally, this is going to contract harder the smaller the aperture we want. So it contracts very hard around the small double reed instruments, the oboe and bassoon, where you have a narrow, this kind of shape that you're trying to make with your mouth. It has to come in a lot, works very, very hard. It's going to work in higher pitch in brass playing to make a smaller aperture, and works less hard in wider apertures or lower pitch. and most other facial muscles are pulling against it. So it's a kind of a tug of war. So the more we pull against orbicularis, we put a bit of stress on it. If we let it win, it opens the mouth a bit more, or we make the pulling out and in both work quite hard to make a nice firm lip structure, like if we're blowing a lot of air through so that it vibrates really well. If your orbicularis, amazingly enough, orbicularis can be much weaker than it should be in musicians, particularly, it really would go across the board, even in people like oboists and bassoonists, it's possible. What you will see is the jaw will try and close the mouth aperture instead. So we want some kind of hole here for the air to come out, right? If our lips aren't closing in, aren't going in this way well enough, what you'll get is this slit instead. So people will clamp down, try and make the aperture narrower rather than a smaller direct hole. This often creates all sorts of issues. So if you have a brass mouthpiece on your mouth, if you're trying to make your aperture smaller by spreading your lips, you'll get often leaks coming out the side. You get these leaks. Also, eventually, if you make the aperture so narrow by closing your jaw and creating a slit, you'll also eventually stop the buzz, which is, of course, counterproductive to making sound. So you'll hear people say, as I'm going into the high register, I lose my sound. And it's often because they're closing their jaw, they're not using orbicularis enough to close in. One thing I wanted to point out in this picture that came from a very famous French horn player, Philip Farkas, French horn teacher, from his book, The Art of Brass Playing, is here you can see him showing this slit wide embouchure compared to a more focused central embouchure. What I wanted to show you here is, this is the other thing to assess. I realize I didn't write it, but the other thing is to assess is how big their upper lip is in the center of the aperture, because this can actually create a problem if they can't make that hole. I mean, he's doing it here. He's got a nice aperture opening underneath. Some people have such a prominent lip shape that they tend to blow under it, not realizing that they just need to lift it and pull it out of the way. They just need to lift and firm their upper lip a little bit more. We'll talk about that in a minute. Our squeezing in, lift it up is quite an important action in this upper lip stability. If you have that shape, it often feels like you have to work a little bit more at that than other people. If we're talking about brass instruments, you also have the ability for the mouthpiece to slightly help you stabilize that. You don't want to be pushing it hard, but it provides just a little bit of support to help correct this. With the woodwind instruments, particularly the ones inside your mouth, the intraoral ones, this is not such a problem. So if we look at it, so I'll just fundamental. So when we look at orbicularis, for example, I've got a straw here. I'll often get people to just do the movement. Then I might use a straw, put it in their mouth, try and get them to hold it as I pull the straw out of their mouth to get an idea of how strong that muscle is. It's a bit of a general test though. They can still compensate with other muscle, other components of their orbicularis. So what I end up doing once I've had this general feel is I will test the quadrant. So I will try and go in one direction and get her to resist my finger. So you can see in these quadrants, I'm going up in all the different directions and getting her to try and resist my finger. Don't let it go into it, so I can feel how strong the different quadrants are. As I said, very often, particularly with one of the upper lips, very often they're not able to push it back against your finger. For those of you watching me do it here, you might want to try it yourself. I imagine you're probably doing this as we go along, hopefully, that you sort of feel which one feels like, do they all feel like they're just as strong as each other, trying to take your finger you push your finger in these 4 different directions and then try and use your lip muscle to bring you back to the center. Now, buccinator is one of my big, I guess always have to get buccinator in good control and good strength. If buccinator is not working, our embouchure generally really struggles. It's even called in anatomy text the bugler's muscle because it's so important in controlling the way the air is fed into the instrument. Doesn't matter which wind or brass instrument you play, even singers know how to create oral resonance by relative greater or lower contraction of this buccinator muscle. The interesting thing about buccinator that somehow I certainly missed when I was studying anatomy my first time round is that the buccinator muscle is this middle part of a circular arrangement. So you have the orbicularis and the buccinator attaches to the orbicularis. It goes back to finish in a connective tissue line here. This little bone here is part of the bone. This is your pterygoid plate. This is the hamulus of your pterygoid plate. So this is a bone that sits behind your molars going down. And then at the bottom here, it's going down to your jawbone. So this muscle goes from muscle to muscle essentially. So there's this bit of connective tissue here that contracts to the muscle, connects to the muscle at the back of your throat, and it connects to the orbicularis muscle here. This is important because it means this can actually close a lot. There's not really very big bony constraints to this movement. We can really change the way the air is being put into our mouth and oral cavity. But not only is it important for narrowing and increasing air pressure in your mouth, it really anchors the orbicularis. So it provides this kind of stability that allows us to pull other muscles to change the aperture shape without interfering with this oral cavity pressure. So it really is a very good, if you like, anchor to the corners of the lips. While these ones are dilating and pulling against it, buccinator is a nice solid firm muscle that just keeps the width fairly stable. The other important thing with buccinator is connecting to this superior constrictor muscle. What is sitting where I have the arrow here is your palate. This superior constrictor muscle is the part of your throat that your soft palate will lift and close against when you're blowing into your instrument. Sometimes people have what's called velopharyngeal insufficiency, so air will come out their nose if they blow. You always need to check this arrangement. Very often there can be defects up here, like with your adenoids or your pharyngeal tonsil. The other thing that can happen though is your buccinators might not be contracting well when you need increased air pressure, so there's not enough closure of this ring. So you get this air leak behind the soft palate and out through the nose. So very important muscle for a lot of function. As I said, it stabilizes the embouchure, makes the cavity of your mouth narrower, so providing increased pressure of air. And it also, when it contracts, helps pull the back of the throat forward, or provides an anchor for this muscle to contract that pulls the back of the throat forward and closes off the nasal cavity. Nearly always when I see someone with orofacial problems, which is pretty much every week, there's an uneven buccinator strength. So I routinely will check this. It's important to note too, as you can imagine, if it's an air pressure muscle, we're not always contracting in. We have to actually be able to control how much it contracts in. So muscles, as I assume most of you know, muscles can shorten and lengthen. They can be controlled to do both directions. And buccinator is no different. So I have to be able to control it to go if I'm doing, sorry, buccinator will make it look like you've got air puffing in your cheek. So I can control the speed of how much I let it go in and out. I can control the volume of how much I let it go in and out. And musicians need to be able to do this. I often stick my finger in it basically to see what's happening with this. I will just quickly show you, if I go back to this picture here. So this number 7 was buccinator. So I try to put my finger about here. So below, this is the cheekbone, is going to be where zygomaticus major goes. So I try and go below zygomaticus major and in front of the masseter muscle. So pretty much right in this kind of center part of your jaw here from the inside. We don't want to be feeling these other 2 muscles if we can avoid it. Sorry, just get to test the inner cheek strength. Sorry, just get my. So obviously I'm nicely gloved up here. People quite like feeling this themselves. Like you'll see what I do in a minute when I'm trying to get her to contract against me. But most musicians also like to feel the difference themselves. What I'm pointing out here is that all these other muscles I talked about that attach to your corner will really move your corner around. Buccinator won't, it holds it still. So that's what I'm indicating there. So I'll put my finger in there. So you'll notice, just be a bit careful when you do this that you don't pull the corner of the mouth too wide. So my instruction to her is when I put the finger in, I want her to try and squash my finger against her upper molars, against her teeth, just using the muscle inside her mouth, right? She's not to do jaw movement, it's just an internal muscle movement that she's trying to squash against the cheek, right? And as I said, controlling it both ways. Sorry to throw you inside somebody's head here. This is just, again, talking about one of the projects I've been involved in Germany is looking at musicians play using functional MRI. So what this does is takes a whole series of photos through their head and oral cavity as they're playing their instrument during very cleanly prescribed time and musical tests. This is the way we can reconstruct the pictures afterwards. So we're looking like it's like someone's head's been sliced through the middle and we're looking from the back view. So this is the left cheek, right cheek. This huge muscle here is the tongue, right? So we're in front of the windpipe. Here we can see the palate, right? And this is actually the nose up here, the back of the nose, right? So tongue, inner cheek, nose. So in a resting position, we can see it's quite symmetrical on either side of the tongue. These are our inner cheek kind of areas. These are our lower teeth down here. Now, as the person's trying to play a high note and they're squeezing, that they should have a narrower aperture. And you can see even here with the space above the tongue, the airway's smaller, so they're trying to push air through a narrower funnel, which is going to make the air come out the mouth faster, and that will help push through this smaller aperture for a high note. But you can see here, this should be quite tight through here, and there's a little bit of bulging on the left side in this area. It's just a little bit less controlled. Now this person felt they were okay on the high note. However, when we get in the middle note, which is where their problem is, so their problem is shifting from high to low in the middle register, they suddenly lose control here of their buccinator on the left-hand side and get this big pocket of air. And this is associated, when they lose their inner support, this is associated with a very strong sideways pull at the front. It's a bit hard to tell with these what is the chicken and what's the egg, so to speak. Like, did the sideways pull meant that they turn off their buccinator, or did it happen because they turned off their buccinator? But this person has dystonia, and this we consider to be a fundamental problem. So the other thing you'll notice even a little bit here is there's it's not as obvious from this picture, but you'll often see the tongue even sort of twisting to try and make up for this pocket of air. Now, when they've gone to lower pitch, where we really relax these muscles because we don't want as much pressure, the jaw's most open. Bilaterally, it's not really bulging, it's kind of relaxed more because you've got a much more open embouchure. But in this spot, going between the two, they can't control this left buccinator. So now if we look at all the muscles that pull against the orbicularis and what they do in brass playing, we have upper lip muscles, so these sort of ones that are like snarling muscles on each side here. And these are very important stabilizers for brass players. So this is a professional brass player here. And you can see these creases that are typical of when you use your levator labii superioris. So it's a bit of a, if you use both together, it's a bit of a snarl kind of muscle. It's kind of pulling your upper lip up and out. Okay, it's not the levator, it's not the one that wrinkles your nose. It's the one that really just lifts your upper lip. We're very asymmetrical often in the lip muscles. So probably if you're sitting here seeing me lifting one than the other, you probably find it not so easy to lift one than the other. I usually find this a good thing to train in musicians to get a better control and strength on both sides, even if it's not absolutely symmetrical. To get people to be able to do this, they can contract both together and then relax on. Both together, relax the other on. Okay, so if they can't initially do both sides, you can get them to contract one and let one side down, let the other side down to get used to how to do it. The smiling muscle, mostly people don't want this levator anguli oris to work. So this is the one that as I said, we had the modiolus where we can sort of go in with orbicularis. We can go a bit deeper with buccinator, or we can lift the corner up with levator anguli oris, or down with the depressor anguli oris. So we have this kind of ability to move that part. This one's not considered that it should be used a lot in, certainly not in brass playing. A little bit more sometimes happens with some of the winds like clarinet. Zygomaticus major is more of a smiling muscle. Zygomaticus minor comes right up next to the levator labii superioris. So this is levator labii superioris. This is zygomaticus minor. And if you were contracting it, it's almost like a disparaging look. It's almost like you're going, really? You really think like that? You kind of have this kind of crease through here. Some people can give these looks very well, have a very good zygomaticus minor. But zygomaticus minor, levator labii superioris, and then this nose wrinkling one, levator labii superior aliquinasi, if you really want to know the name of this one. These are responsible for all our upper lip lifting. And it seems particularly that zyg minor and levator labii superioris are quite important to help stabilize the upper lip in brass players in particular. And zygomaticus major plays some role, but we don't generally want that big spread. We want the upward support. If we look at lower lip muscles, we have depressor labii inferioris, and it's the muscle that does that movement. Very important. So it widens and helps protrude the lip. So when it acts with orbicularis, it pulls the lower lip out and down. So it does that movement. Again, can do it both sides or do it together. If we use orbicularis more, we'll get this narrowing and sort of a spout shape of our lower lip, which is very important for like dropping register in a higher pitch brass instrument, French horn players or something. So that kind of movement. So they should be able to do these movements off the instrument. So I do things like get them to hold a straw, get them to try and narrow orbicularis, and then try and push the lower lip out and down, so it goes away from the straw a little bit. And just to start to learn to try and control these muscles. Mentalis works a bit in brass playing. Brass players do not want to see this chin. And if you think about it, when we use mentalis, it pulls up and blocks the air. So it seems that we use mentalis a bit with the depressor labii muscles. So we pull them down and push the lip forward, but we don't actually let the chin go up about this. This closes off the aperture. No one wants to see a chin like this as a brass player or any other wind instrument for that matter. So when we use mentalis, we use it with our depressor labii inferioris engaging here, and then we might use the lower lip protrusion. And depressor angularis, I'm bringing this one up because this one can be quite problematic. People will try and stabilize their upper lip, particularly brass players, by pulling down here because they don't really understand the mechanism. And I've seen terrible tears of the orbicularis from this action. It also seems when you do this that buccinator turns off. By pulling down here, you're not using your buccinator well. So generally this does not seem to be a good way to pull these corners. All right, so that was a little bit of a summary. You have this balance, you have these upper lip muscles, you have ones that can widen, you can go up and down, and this lower lip depressor, the one that does that, is kind of the counterpart to these elevators. And our real corner muscle that I didn't put in here that stabilizes the whole lot is buccinator, because it's just keeping our depth in there. We can pull against it, we can do all these other movements, but buccinator will just keep those corners of the lips in the position that you set them at when you decide how wide or narrow you want them to be. So we have this kind of communication with orbicularis. We add our other muscles to it, and buccinator holds it in place. The others have to move a bit to adjust the aperture. Buccinator also depends how much air pressure. As I said, it's varying too, but we need all of them to work together. They all have to be team players. So when we look at these, it's just understanding that we have to have the mouthpiece in a position where we can get air flowing through the bore. We don't want to see compensations where bad muscle strength or not having enough control means they just push the mouthpiece in harder. You get all sorts of tears and nerve damage if people do this. You also have to check teeth in some of the players. Sometimes the teeth themselves can cause a problem. Normally they'll have that sorted out. In fact, normally it's more the opposite problem. They try and get their teeth shaved or moved or have dental surgery when really they have like a muscular embouchure problem. They'll often try and attack the teeth first. Clarinet comes in, and saxophone, these instruments have this kind of bass positioning on the lip, and as I said, jaw tension here is what we've got to watch out for, that they're not over squeezing and over pressuring. Again, need some good buccinator action. And we have to also watch that they, when they have a breath in, that they release the jaw tension just a bit. And I usually get them to think of the jaw back here, so when they breathe in, there's a bit of a release. You'll see a lot of them, if they never turn off their jaw, that you'll see them lifting their head to breathe. This is again disastrous on a lot of the muscles controlling the upper respiratory pressure. So we don't want to see head lifting breaths. We just never want to see this. This is associated with all sorts of problems. This is what a double reed looks like inside your mouth, very high pressure, so you can see the tongue is up. We've got a narrow airway to try and push into this very high resistance. We looked at muscle activity here, and orbicularis oris is working super hard on these guys. The reed's very, very narrow, and so by this kind of inward action, they will get tired very, very fast if they're playing too long without a break. They need to be very strong in every part of their orbicularis. And as I said, the flute rests against the lower lip. This engagement of the lower lip against the flute is very important. We've done muscle activity measures here. And the lower lip in harder repertoire should be really much more active working with the flute. So the depressor labii inferioris and mentalis appear to be very, very important muscles for flute players in particular. The other thing to say, this graph, sorry to throw a graph, this is one of our electromyography studies. On the side here, you have the percentage of the maximum a muscle can work. This was a less intense piece and a harder piece up here. So we get a big variation. This is the French horn. We get a big variation in effort, but very high efforts. Like a lot of these guys are using face muscles up to 40% of their maximum. This is mentalis, depressor labii inferioris, buccinator, zyg major, levata labii superioris, and the superior part of orbicularis oris. So the other thing to note is when they took a breath, they still had 10% of muscle activation. So this low side here, approximately halved taking a breath, but they don't lose their embouchure formation taking a breath. It doesn't completely relax. They have to maintain a slight shake to it, ready for the next note. So what do? We need to look at all these muscles that we've just sort of run you through and shown you how they moved. See, look for symmetry, strength of the muscles. Very important ones are like your depressor labii inferioris and those elevator combination, particularly levata labii inferioris and the zygomaticus minor, buccinator and orbicularis. These need to all be in very good control and ideally quite strong. We need to double check, make sure the jaw's not getting in the way. Check for lip abnormalities, like where they've been. If you see that someone's been really squashing their mouthpiece into their lip, they can get bruising or blanching or all sorts of other issues. If those lip abnormalities are there, be very suspicious that their foundation of stability, like with buccinator and orbicularis, is not ideal. I'll check their breathing. So I usually get them to do some coordination and strengthening exercises off the instrument, gradually making them faster or combining breathing with them. And then we can do things like exercises that are a little bit more complicated, like making the buzz without the mouthpiece on the mouth. This is facial gymnastics to me. There's a lot of people saying it's not the same as playing because normally you have support and back pressure and resistance. It's very important to note that, but it can be a useful way to exercise the face muscles. And just as one point, one person who's been very open about his story is one of the Wazo players who's in perfect shape now, but had a very difficult time with his embouchure. Again, just not having the foundation of knowing what to do. So at the time I saw him, couldn't play in the orchestra anymore. This, I think, is funny because I asked him to talk about, or if he minded talking about what it was like. And I think what's interesting is that basically when we're talking to them as anatomists and health professionals, it's quite shocking because we're saying a whole lot of things that they won't have heard before. And it's important to be aware of this, but also to understand that once they get the idea of this and feel of this, it's such a mind-blowing thing for them. And in this case, this person has been so able to calmly and well control things that he's also been able to teach very effectively and be able to help people. Yeah, so you certainly can work with them. You just have to be aware that like to understand how this works, they often haven't had this knowledge, so it's a bit confronting when we talk to them about it. All right, I'm sorry, there was a lot of information, but hopefully please feel free now to ask any questions. Come online, I can make faces at you, you can make faces at me, whatever you would like, but if anyone has any questions or wants to run through anything in more detail, please show up, show your video, talk to me.